loss of blood supply, for example, leads to deficiencies in some functions of nervous system. But when the word lesion comes, we restrict it to an area of brain, area of nervous system we should say, where the function has become impaired, where the function has become defective. So this defective or dysfunction either with CNS or with PNS. If you recall back, the spinal brain and spinal cord will constitute the central nervous system. Rest all is peripheral nervous system. So defect at any level in brain and spinal cord, that is lesion of CNS, then otherwise it will be a lesion of PNS. Secondly, in a lesion there can be a structural change. So basically the anatomy has been disturbed. The anatomical figure structure has been disturbed. Or it can be functional deficit. So physiology has been disturbed. So at two levels these defects can occur. Either we have got a central nervous system problem or a peripheral nervous system problem. When we see symptoms and signs, what the patient presents tells and what we check, we have got either structural damage or functional damage. So damage is either anatomical damage or a physiological damage. Now when we think of functions, the function when it becomes damaged, it can be deficit, decreased, or it can go to a status of increased status. So it can be hyper or hypo status. So these two levels are also to be considered. Then what will be the cause is a long topic. We will not go to the causative factors, but just discuss at which level the lesion has taken place. Now whenever there is some problem with the brain, that means neurological problems, they say that we can follow this basic rule, basic principle, and this is number one. We can look for signs and symptoms which can lead to focal changes. Focal means at a localized place. So these symptoms, they can be due to a single problem or a group of problems. Secondly, when we, as comparison to the single problem, we can see a multifocal pathology. Now this will result to more damage. The causative factors will also be more. Then there can be diffuse dysfunction. We cannot localize whether it is focal or it is multifocal. So these three broad-based lesions can take place. Now whenever we see a patient with neurological symptoms, we have to decide some basic rules. First thing is that, is there a lesion? What does this sentence mean is that the presenting symptoms which the patient is telling, for example, inability to move his or her left arm, upper limb, for example, is it really he or she cannot move or some other problem? So we have to decide if the lesion is there. Second, where is the lesion? Level of lesion. Then what the lesion is. Is it a focal? Is it a multifocal? Is it a diffuse? And third, do we have a treatment for it? In most of neurological losses, because we know that nervous system is the system which cannot tolerate
ischemia for a longer time as compared to other tissues of the body. So a very small time damage, closure of the vessels will lead to a permanent damage. Once the defect has taken place, it cannot be recalled back. We cannot go back to normal. So basically, treatment option should be labeled as a management option. We manage the patients. We just try to keep the patient in a status where he or she can live his or her life to a comfortable style. So we will see all these factors. Now basic rules for this, any patient when we see. Now you will start visiting hospital and see these patients. So we have to follow a systemic approach. All these systems, they are meant for one main purpose. The purpose is that we should not miss any step. So basic rule number one, at the top comes the history of the patient. Now you are familiar from your first year, you have been doing with the core also. That was the basic training to how to talk to patients, how to scratch out the information from the patients. So history is very, very important step. Now this history will include, starting from, it is again a systematic approach. This will start and will tell us about the nature, onset, extent and duration of the symptoms. What the patient is telling, we have to check for the time, since how long they have been present, what are the symptoms, how they started, what is level of extension and nature. Then it also includes the previous history, past histories, including the family history, personal history, for example, some habits like smoking, drinking. So all these with personal history, family history. Then we have got occupational data, some professions, for example, they can affect. For example, in paramedical professions, the persons, the paramedics who are involved for example, radiological investigations, they are exposed to radiation, so more chances for problem with the damages. Then some of the symptoms are very important. We look for these symptoms, we discuss with the patient about the nature, about duration, time. So we have a list, at least these 4 symptoms must be checked in detail. And these are headache, the seizures, pain and visual disturbances. They give all these 4 steps will give a clue to the cause of the disease. We have, for example, a dizzy patient with a complaint of double vision. So when we check it, we discuss and we go back to our knowledge, we recall back our knowledge, the lesion can be in the brain stem. Then right hand numbness, aphasia, maybe a cortical lesion. So we will see that. So basically what we mean, the first step is the proper history. Proper history will include at least the start, the nature, the extent, plus at least these 4 symptoms in detail. Then on examination, physical, clinical signs, what we see as physicians are the signs, but the patient will tell are the symptoms. So after the symptoms, we go for signs. For example, hemiparesis, we will decide the possible side of the lesion. So which side is affected, how, what is the extent of this affection and all this. Then we have got specifically with all systems examination, mental, neurological examination. And this will include mental examination. Look at the status of the patient, confusion, excitement, mental deterioration, mania, lethargy, anxiety,